Hi all, welcome to a new video. Today I am here to talk something about a part of the management of diabetes mellitus. A part of the clinical approach of diabetes, a clinical approach to diabetes. So, in which kind of patients should we start with insulin? So, according to Endocrine Society of India, the ESI Guidelines, there are 4 categories of patients with whom it should start insulin immediately or should give directly insulin. There is no role of oral hypoglycemic drugs in these categories of the patients. The first category is the type 1 diabetes mellitus or LADA. LADA means latent autoimmune diabetes of adults, in adults. LADA. So what is LADA? How to rule out LADA? To rule out LADA, you have to check for the fasting C-peptide and the antibodies. If the fasting C-peptide is normal and the antibodies are negative, then it is confirmed that it is not LADA. You can rule out LADA. It is type 2 diabetes mellitus. So type 1 diabetes mellitus or LADA is the first category. Second category is that the patients also having microvascular complications like retinopathy, neuropathy, nephropathy, all those things. If it is there, you can directly start with insulin. The third category comes with diabetic ketoacidosis, DKA, or any kind of infections like UTI, urinary tract infections, skin infections, soft tissue infections, lung infections, etc. So these third categories, DKA or any kind of infections, you should start insulin immediately. And the final category is that if a patient starting with HbA1c more than or equal to 9.5%, the normal value should be less than 6.1 or less than 6.2. Okay, borderline is 6.1, 6.2. So here a patient comes to you with a HbA1c of more than or equal to 9.5%, then immediately you have to start with insulin. There is no point of starting with OHA and wait and see. There is no don't need to waste time or delay in the treatment of those kind of patients. So HbA1c more than or equal to 9.5%, it has to be started with insulin. These are the 4 categories of ESI, Endocrine Society of India. Actually, one more category is there, that is that it's like a macrovascular complications. A patients, those who have had a history of stroke or MI or such kind of macrovascular complications, those categories also included, but it's not included as of now in the ESI. It's not included in the European Society, in the Endocrine Society of India. ESI Guidelines is not included. So there are 4 categories. The first one is type 1 diabetes mellitus or LADA. Second one is the any initial diagnosis of microvascular complications. Third one is the history of DKA, or a patient is having DKA, diabetic ketoacidosis, or any kind of infections. The fourth one is a patient with a history of a patient who is having HbA1c of more than or equal to 9.5%. So these are the 4 categories which according to the ESI, the Endocrine Society of India, where we should start the patient with insulin. And insulin, nowadays we have an insulin pump. I have done in one of the video, I just told about insulin pump, artificial pancreas. So insulin pump is actually it costs around 2 to 3 lakhs. So it's not we cannot buy all of a sudden, but those who are having money, it's the best choice. It is an automated insulin because it automatically see the level of the glucose and it can be given the insulin. So best is known as artificial pancreas, insulin pump. That is the best mode of treatment nowadays if you have money. Like initially you have to invest 2 to 3 lakhs to buy that insulin pump, but later every month you have to maintain like 15,000 per month. Long term it is okay, but for us like those who are not affordable to buy, it's a difficult task. But if you have an option, insulin pump is the best thing. What is according to the present condition, it is a better thing to have because it gives insulin. Automatically it can be monitor the glucose and it can be given insulin. So artificial pancreas or insulin pump is one of the advanced form of insulin mode of treatment. Okay, so we have many types of insulin, human insulin, all those things are there. So that's about the clinical approach of diabetes. I mean, the part only I have told. I didn't mention about oral hypoglycemic drugs. There are many other treatment. What we study in pharmacology earlier also, we have told many other treatment is there. So HbA1c is an important role. Usually we have to maintain HbA1c in the border of 6.1. If up to 7.1 is a fair, means 7.1 you can give, it can be given as oral hypoglycemic drugs and it can be controlled. But if you have according to ESI, if it is more than or equal to 9.5, immediately you have to start with insulin. Okay, that's all about my video today. Thank you.